Welcome to Adapting Class. Do you know the correct position for paracentesis, lumbar puncture, or prolapse cord? Most students get this wrong on the NCLEX or NCLEX school. Let's fix this with 35 patient positioning for therapeutic procedures. We're going to make it more memorable, friendly, so that you can use it whenever you see this question. And by the end of this, you will never get these questions wrong. What is the first question? On paracentesis, a nurse is preparing a client for paracentesis to remove acidic fluid. Which position should the nurse place the client in during the procedure? In all of them, I'll present the case so that you can have a real life. You can relate it to yourself. This is the problem. This is where the question is going to be. Whether you're doing clinicals, this will they be. What do you think? Which position should the nurse place the client in during the procedure? The way the patient has to be is for paracentesis, we go into the abdomen to remove fluid, acidic fluid. We want to do it in the dependent position. So the patient has to be in a high follow-up position, putting their arm over a table. That is the position, and that's the question. That's the answer for this question. Write it down. All of them, I'll give you the answer. I want you to write them down. High follow-up position for paracentesis procedure. Next question. After the procedure, a client reports what? Dizziness after paracentesis and has blood pressure of what? That 88/54. What is the priority post-procedure action? This is what the NCLEX will ask you, and this is what nursing school will ask you. Look, patient in shock. Why? Because you remove the fluid. The fluid in the abdomen is their own fluid. We forget about it. You got to replace the fluid. What fluid do you use? Don't use isotonic fluid. Don't use hypertonic fluid. Use colloid. What kind of colloid do you use? Albumin, 25%. Write it down. 25% albumin is the best answer to replace because the liver does not work. That's the first thing you should know about. It's the most important thing you should pay attention to. Next question. We have a lumbar puncture. What is the issue? This is a rapid fire, comprehensive review, crash course so that you can master this. There are 35 of them. Stay with me. Take a pen and paper and write them down, the answers down. A nurse is assisting with what? A lumbar puncture. What are you doing? Which position should the client assume during and immediately after the procedure? 2 questions in one, right? First, what position should the patient be during the procedure? Left side laying is the best position. So they're going to lay on your side, sometimes on the right side. It depends on the provider, but so far as they are on side laying is enough. Then after the procedure, you want to prevent CSF leak. The puncture, you want to put pressure there. How do you put pressure on the skin? Make sure that skin is touching the ground. So what do? They're going to be in the supine position as much as possible. So that is the position we're going to place them post-procedure. Next question, liver biopsy. What do we have? A nurse is caring for a client after a percutaneous liver biopsy. The liver is on the right upper quadrant. Which position should the nurse place the client in post-procedure? Same thing. Before the procedure, they lay supine. You put their right hand over their head so that they can get access to the right side. Then after that, we need to apply pressure. So the patient has to be on what? What do you think? I want you to put the answer choice. This one is a high priority. Put that in the comments and let me know. But because it's on the right side, we have to put pressure on the right side. So right side is where they're going to lay post-procedure, and that is liver biopsy. Kidney biopsy. Where is the kidney is located? On your back, retroperitoneum. And nurse cares for a client following a what? Renal biopsy. That means after the procedure. Which position is appropriate to apply pressure to the biopsy site? Yes, when they do the procedure, you're going to be on your face, prone position, your face down over the pillow. After the procedure, we have to apply pressure to the back where they did the puncture. What did I say? To apply pressure on the skin, make sure the skin is touching the ground. So they're going to lay what? In a supine position. Therefore, if you see a patient post-kidney biopsy, and they are not in a supine position, is a priority patient you should pick. NCLEX prioritization. That's the key. We're dealing with patient prioritization in terms of what? Positioning for the client. So pay attention, write the answer down. Thoracentesis. I'm going into your chest. There's fluid there. You see the definition? Thorax, chest. Centesis, fluid. What am I doing? I'm using a needle to remove fluid from your chest. What am I going to do? I'm going to puncture your lung. And nurse is preparing a client for thoracentesis, which position allow optimal access for needle insertion. That means what is the best way to position the patient so that we can get access to the fluid? It's the same thing. Dependent position is best. So this patient are going to sit up and lean forward during the procedure. Sit up and lean forward, right? Like paracentesis. And after we puncture the lung and we remove the fluid, I'm using the word puncture the lung. You put in a needle through the chest. So the complication is pneumothorax, but we are not actually puncturing the lung. We're trying to remove the fluid, but just to give you an idea. After the procedure, because we put a needle in the chest, we have to make sure the lung recover. So every time they give you a question, do a procedure, make sure that area of the chest is up, not down. So if we puncture the left side, what are we going to do? We're going to place the patient on the right side. So after procedure, we are going to be on the right side. So pay attention to that. What is your score so far? I want to keep tally of the score. Put it in the comment. Let me know what is your score. Now we are on ear drop. What is the question? A nurse is administering ear drops to an adult client. How should the nurse position the client here for administration? If you go and look at any tube bank, anywhere you go, this is the way the question will be when they're asking you about eardrops, because it's a classic presentation. There's two things, whether it's an adult or a child. Anybody more than 3 years is considered an adult. If you want to position the patient, is what? An adult, you go up. An adult, you go up. An adult, you go up. So up and back, up and back. So this patient here will be pulled up and back. And therefore, following that is a child. And nurse is administering eardrop to a child under 3. So it's younger. How should the nurse position the ear for the administration? Because you're younger, you're going to go down. So down and back, down and back. This is very straightforward question. You should not mix that. And I know by the end of this, you've mastered. We always 1/3 away from the lecture. Now you got to know how to irrigate the ear. This is the key, very important. And nurse is irrigating the client's ear to remove what? Remain. What position and technique should the nurse assume, right? The same thing. Remember, now we're removing, we are not putting anything there. So we need a better access. You cannot pull the ear down and back now. Now we want you to be upright because we don't want fluid to go into your ear. So the patient is going to sit what? Upright with the head tilt towards the affected side. So on your right side, if that is what we're removing the ear wax, you're going to sit up and you will tilt towards my side, the right side, so that when I put the fluid goes in and comes out easily. Don't forget that. Make sure the fluid is warm and gentle installation. Otherwise, they will syncopized. They will go into syncope and then get into trouble. So once again, upright with head tilt back. Now, eye drops. This is key. I want you to take a pen and paper. A classic NCLEX and nursing school student question. They like asking that. A nurse is that administering drops. Where should the nurse instill the medication and how should the client be positioned? Yet, high drops is very, very important. You have to know how to apply it. The best way is not to put it on the cornea. The cornea is the white thing. No, go into the inner side. That is the conjunctival side, the inner side of your eyes is where the conjunctival site, and instill it over there. One thing you should do after that, if you don't do this step, you're going to feel it in your nose. And let me draw it for you. Conjunctival sac. If these are the two eyes, you inject it here. But unfortunately, this is connected to your nose. So when you inject here, you got to apply pressure in the nasal lacrimal duct. Put your hand there and hold it for at least 30 seconds. So that is the key. We are 10 questions now. We started with the high fowler position for thoracentesis. We deal with, we give the patient albumin when they became hypotensive. We talk about laying, side laying when we come to lumbar puncture. And then after the procedure, you got to lay supine. We talk about liver, where you have to lay supine with your right side up and over your head. After the procedure, you lay on your right side. We talk about the kidney, where you got to lay prone before the procedure and supine after the procedure. We talk about thoracentesis, where you got to do what? Sit up and then lean forward. After the procedure, you're going to lay on the unaffected side. And the eardrops, how you have to position the pin based on what? The individual age, where the adults, you got to be up and back, and the younger, you got to be down and back. And then we talk about what? Eardrops and eye drops. Now, we're moving on. To air embolism. Air embolism, very, very important. A client receiving TPN via a central line become acutely dyspneic. Which emergency position should the nurse place the client? That's a classic presentation of air embolism. On the test, they're not going to tell you it's air embolism. They will give you this question, and you have to remember that this is air embolism. The best way is to prevent from air going to the lung and the heart. And therefore, what do? You place this patient on the left side. After that, you place their head down. So left-sided laying and Trendelenburg. That is the best position. How do you prevent this from happening? You let the patient Valsalva when you pulling it out. You know this already. Epiglottitis, very classic. A client present with drooling, stridor, respiratory distress. Which position should the nurse encourage while preparing for airway management? They come in, they'll be in that position, whether you like it or not. Don't put them flat. Don't look into their mouth. Let them lay the way they are. We call it tripod position. They're sitting up and they're leaning forward with their hand on their waist. Tripod position. Kawasaki disease. These patients usually have cardiac problem. A child is admitted with Kawasaki disease in the febrile phase, which nursing intervention related to positioning and environment should be prioritized. You see the word febrile phase. That means they still having fever, and the major complication associated with this, if they have fever, is cardiac problem. And therefore, what do you want to do? Let this patient rest. Restful, peaceful position as much as possible in an environment that is quiet. Rheumatoid, they're going to complain about it. Stiffness. A child with A client with rheumatoid arthritis complain of morning stiffness, which positioning or support should the nurse recommend during rest period? What do you think? To prevent stiffness in this patient, what we tell them is to make sure that joint is mobile as much as possible. So when you're sleeping, make sure you keep the joint in the neutral position. Small pillow under that as much as possible. And don't keep it in a non-movable position for a long time. Otherwise, you get contraction. So the key when you see a question about rheumatoid, keep the joint in the neutral position, small pillow under that, and straight as much as possible. That is the key for this particular question. You're going to see this total hip replacement, straightforward, and then provide postoperative teaching to a client about total hip replacement. Which position or action should the nurse avoid to prevent dislocation? After hip replacement, we don't want the hip to come back together. Therefore, what do? We put something in between and push them away from each other. We call it Abduction. So this is the two legs, and this is your hip. We want them to be away from each other. So we want abductor wedge. We don't want adduct, addition. Don't bring the two legs together. So place something to separate the two legs. That's the position the nurse is going to place this. Cord prolapse. During a labor, a nurse identify an umbilical cord prolapse. With immediate position, should the nurse place the client while preparing for emergency delivery. You want to push the cord in, not with your hand, but what? Mommy allowing pressure and gravity. Therefore, what we do, knee to chest position, knee to chest position, knee to chest position, not lateral position. Shoulder dystocia. The kid will come out and your head will go in and out, bob it in and out. We call it the turtle sign. If infant is born with shoulder dystocia, which maternal maneuver or position should the nurse assist with first to relieve the obstruction. Mommy, knee to abdomen, then counter pressure to what? Suprapubic, not fundal pressure. Once again, not fundal pressure. Suprapubic after you bring the knee to the abdomen. This is what we call McRoberts position. So that's what you're going to do. Now, we have an NG tube. A nurse is preparing to insert an NG tube and begin what? Tube feeding. Which position should the client be placed? The buzzword is what? Aspiration. What is the best position to prevent aspiration? Either you lay on your side or upright. But because this patient receives food, we can't put them on their left side. We have to keep them what? Upright as much as possible. So upright, high fowler for 30 minutes after feeding. Enema, straightforward. A nurse is administering an enema or rectal suppository, which position best facilitate installation and flow, whichever allow the sigmoid to remain in its natural position. And this is what we call Sims position. So we're going to place this patient in the Sims position. Write that one down. And the colonoscopy is the same thing. A nurse is preparing a client for colonoscopy. Which position is used during the procedure and what should the nurse monitor for post-op? In the position, you're going to lay in the same side, mostly on the left side, so that the sigmoid is facing the provider, the one who's doing the procedure. So left side in the same position, same way. And after the procedure, watch for peritonitis, for perforation. You know cardiac catheterization, right? We go into your groin. And there is going to be hematoma. There is going to be bleeding. You're going to have Kerlan sign, Great Turner sign, bruises in the groin. Therefore, we don't want to move. After the procedure, you remain flat. That leg, so the key is the word. Look at the wording. Supine, number one, and the affected leg, what? Has to lay flat 4 to 6 hours. That is the key. Once again, affected leg has to be what? 4 to 6 hours. There is a way they can write the answer choice, and I want to show you. I said what? Supine, and you have to, the affected leg 4 to 6 hours. But you can keep individual supine with their head up, right? The bed can just be raised without you not flexing them. So they are up like that, and then still supine. So they can lay up like that, so the whole bed is tilted. So pay attention if they tell you supine with the bed flat up. That's still supine. Thyroidectomy, we don't want bleeding, right? We don't want bleeding. We don't want the suture to fall apart. So what do you think we're going to place this position? We're going to take pressure from your neck. So we're going to leave them in the semi-fowler position, and we keep the head in the middle, and then you support the neck. Once again, semi-fowler position, head in the middle, and support the neck. Tonsillectomy. Tonsillectomy, we're removing the tonsil. The major problem is bleeding. Where does the bleeding go? Either it come out or you go into your lung, aspiration. Therefore, after the procedure, we will prevent aspiration. We're going to lay you on your side, left lateral position. Write them down. This is intraocular pressure. Same thing. After you have high surgery, Semi-fowler position is good. You make sure you don't lay on the side that they do the surgery. Otherwise, you're going to have high pressure. So semi-fowler is the best position. Mastectomy. A client is post-op after mastectomy. What do you think? I know you know this answer. If you know, put it in the comment. Let me know. I want you to know. Mastectomy. Hashtag mastectomy. What arm and body position should the nurse encourage to promote drainage and reduce edema? The idea is to remove edema. So anything that can remove fluid it has to be upright, right? So what you're going to do is going to put them in the semi-fowler position, and you're going to raise that, put a pillow over the arm that they do the surgery. If they do both sides, both of them is above, there's pillow under the arm so that it can allow drainage. Amputation. This is key. If you have a pen and paper, I want you to write down because this is a tricky one. This is what the NCLEX will ask you. It's a good one. The client had a below knee amputation. Classic question. What position is recommended in the first 24 hours and afterward to prevent contraction? Because if you don't do it right, we have a problem. So what do we do? First 24 hours, we're going to keep the patient flat with slightly elevated of the amputee leg. After that, after 24 hours, they're supposed to lay prone in that day. So 3 times or 4 times in the day, they're going to lay what? Prone in 30 minutes duration. That is the key. If you want to suction a patient who has tracheostomy, what do? A client with tracheostomy requires suctioning. Which bed position optimize ventilation and secretion clearance? Ventilation, you got to be up. That's all. Semi-fowler or high-fowler. Don't make it difficult. These kind of positional questions designed to test your critical thinking. And I know nursing process tell you have to always prevent harm and therefore lift the patient up. That will help with clearance. Chest tube. The nurse is assisting with the chest tube insertion. What position should the client assume for insertion and what is recommended head of the bed position? For the head of the bed, what do you think? When they are going to do the procedure, they're going to be supine. Their hand is going to be what? Put over their head where the procedure is going to be. And the head of the bed, usually in the flat position as much as possible. And this is the way you can do the procedure. It's the same thing like you're doing liver biopsy. The hand, you got to give access to the chest as much as possible. And when removing the chest tube, this is the key. Chest tube removal. After chest tube removal, what immediate positioning and drainage action should the nurse perform and monitor for, right? What do you think? What should you monitor for? Pneumothorax, pneumothorax, pneumothorax. So watch for that, check their respiratory, and make sure they're doing well. Increase in ICP. A client with increased intracranial pressure is being monitored. What head and what bed position minimizes ICP and promote venous drainage? The key word is venous drainage. That means you need to come down. So you got to raise their head up. 90 degrees is wrong. It should not pass 30 degrees. Write that one down. The key is what? 30 degrees. The more you go up, the more the effect of the drainage affect the brain. You don't want to drain all the blood from the brain, but you want to drain enough to decrease ICP. So 30 degrees is the best. After surgery, post-craniotomy is the same thing. A client is post-operative craniotomy. Which position should the nurse use to promote cerebral drainage and protect incision? Same thing. You should not place them on the side where they remove the brain, the cranium, right? That's craniotomy, removing the skull out. And during that procedure, they get to remove it. So if there's no supporting structure over the brain and the head of the bed is 30 degrees. You know this already, right? Very important. A seizure patient, a client beginning having generalized tonic-clonic seizure. I'm giving you the scenario so that you can know, you can apply. Which immediate position should the nurse place the client in the protective to protect the airway and prevent aspiration? Aspiration, aspiration, aspiration. We talk about what? Laying on the left side. Side laying is the best way. A patient with suspected pulmonary embolism develop dyspnea, hypoxia. Which position promote oxygenation? Something that will allow the lung to expand. And which position? Fowler position, high fowler position. Don't memorize it. Let it make sense. Something like this. A client who is what? Hypovolemic shock. We want more blood. require stabilization. Which modified positions support venous drainage and promote perfusion to organ? If you're in shock, we want more blood to go to the brain and then to your heart. Therefore, how do we do that? We call it modified Trendelenburg. You elevate their leg goes up, and you keep their trunk flat. So what is that? This is their trunk. Trunk is flat, and their leg, this is their leg. Like that's modified Trendelenburg. So leg elevated, their trunk is flat. That's their torso. So when you see that, this is what it is. So that blood can go to the brain. A pregnant client at term report these lightenings when supine. Which lateral position we leave vena cava? On the left side. Left lateral is the best way to allow the vena cava to recover. How are you doing so far? We're almost done. Few more slides. We passed our limit, almost 30, and now we're left with what? 5 more. Peritoneal dialysis. What do you think? When they place the patient on peritoneal dialysis, a client is beginning peritoneal dialysis, which position facilitate inflow and outflow of dialysate. Think about it. We don't want obstruction. If you don't want obstruction, something that can flow straight. How is your body going to remain straight? By being in the Fowler position. Fowler position, semi-Fowler is good. This will allow inflow and outflow. Once again, I said, this is a crash course trying to give you the simple, straightforward information. You can watch this video in a very short time so that you can take your NCLEX or NCLEX school exam. This is your guide for all position and the reason behind and what you need. Central line, we want to prevent embolism, right? A client is having central line insertion or removed, which position are used during insertion to distend the vein and during removal to prevent embolism. That's what the NCLEX will ask you. This is IV therapy complication. When we put in IV in, we want the vein to get bigger. If I want the vein to get bigger, I want more blood to flow. How do I allow more blood to flow? I put your head down. So Trendelenburg, you put your head down as much as possible, and you can stick the vein. After the procedure, to remove it, they need to remain supine. 1, 2, you don't want them to suck in air. So what they need to do is what? Don't suck in air, right? Don't do that. If you do that, then we're going to do what? Cause embolism, and that will be a problem. This one, we use it for spinal analysis, right? Spinal cord analysis. The client has what? Myelogram with contrast. What head of the bed position is recommended post-procedure to prevent contrast migrating to the brain? When we inject contrast, studying the spinal cord and the brain fluid and other thing, you can have contrast get to the brain. In order to prevent that, what do you think? Head of the bed, 30 degrees to 40 degrees, as much as possible. And this is the best way to do that. We saw this is the same thing as what? Cardiac catheterization. Cerebral angiogram, left, the leg is going to remain flat 4 to 6 hours, right? The body can be up, but still supine. And you know, how do you prevent damping syndrome? A client is post-operative after gastrectomy, which positioning after meal helps reduce symptoms of damping syndrome. What do you think? Damping syndrome. It means when you eat, it's damping into the ground, into your abdomen, into your small bowel, and then you have signs of symptoms of damping. How will you prevent it? Lay flat. This is the end of it. 35 procedures that, if you know it, there's no positioning question that you mix. We're talking about client positioning for the NCLEX and NCLEX school. Thank you for watching. And if this video will make things easy for you, just leave a comment, subscribe, share it with your friends for more content like that. Take care of yourself and bye.